Guys,
Ready on?
good evening, everyone. We're going to begin our meeting. Good evening. I'm Rosemary Holt. I'm Chair of the Board of Health of Delaware County, and I am calling the meeting to order. At this time, there should be agendas available in the back of the room for those who missed them. And chair announcements. I am deferring my announcements to a little later in the meeting. You'll understand why at that time. At this point, we will have public comment on agenda items only. Is there public comment on any of the agenda items listed? I see none. We'll be moving on. At this time, I would like to have the approval of the minutes from our previous meeting. Do we need a motion for that, please?
Approve.
Second it?
Second.
Second it, Anne Marie. All in favor?
Aye.
Any opposed? The ayes have it. The approval of the minutes has been made. Okay, and at this time, we're going to have the board updates. And do you want to speak to the first item?
So good evening, everyone. I'm Melissa Lyon. I'm the director here at the Delaware County Department of Health. My updates for you this evening for the agenda that was put forward a week before today's meeting included the status of our Pennsylvania Department of Health application to become an approved public health department. That application had been moving through the process and was placed to go in front of the secretary. I will give more updates on that under new business. And we also had the opportunity to move into what we call Baldwin Towers, which is in Eddystone. And that is where we're currently housing our environmental health staff, as well as our personal health and some of the population health staff, as we are still building out our facilities to host all of the staff in Yeadon and then in Fair Acres into the future. Those are my updates, Chairwoman.
Thank you. And at this time, we were going to have an update on the COVID numbers from the Dr. Victor Rouland, the epidemiologist for the Delaware County Health Department.
Hi. My name is Victor Alos. I will be happy to present some brief numbers about the COVID update, current COVID status. Okay. So the data that I'm going to share with you today comes from publicly available sources from the Pennsylvania Department of Health, a database that captures all reported diseases and allows health departments, state health departments, local health departments monitor the health of the population and try to prevent the spreading of diseases. So I would like to show you the first line here. Regarding COVID, as of February 25th, the total number of weekly cases, that is every single day of the week for 7 days. This month, we had a total in a week of 325 altogether, all 7 days. Compare that to what we had in the beginning of the year. We had a total weekly number of 8,867. So it's a big, big difference in terms of the number of new cases per week. When we look at the number of cases per day, right now, this month, February 24th, we had in one day 46 new cases. Compare that to January 6th, we had in one day 1,827. So a big, big difference. When we look at the total number of cases by gender, female and male, more cases among females, 57,981 versus males, 48,000. For more female reported in the system as being infected with COVID. When we look at the incidence rate, which is the number of cases in a population, that's a measure that we use many times to measure all diseases. Delaware County has the second lowest incidence rates compared to other counties nearby. Positivity rate, which is a measure of how well we are gaining access and testing our population, the number here is less than 5%. Now, currently, we have a positivity rate of 4.7, less than 5%. Compare that to our positivity rate earlier. We had a positivity rate of 40. So 40 versus 4.7. We're still doing a little bit not as well regarding the number of emergency room visits due to COVID. And the overall trend in death due to COVID is decreasing also. The number of individuals on ventilators because of COVID is decreasing also, as well as the number of hospitalized due to COVID. What is only going up is the number of persons reporting to the emergency room due to COVID. Like other jurisdictions, our county is experiencing a decrease in the number of persons that are fully vaccinated and partially vaccinated with boosters. But that is happening all over the United States. I would like to also show in this chart the number of cases. Second, please. Now, as you can see, this is Delaware County, and we're going from April 16th of 2020 on your left, all the way to your right to this month. And as you can see, the higher number of cases in one day, cumulative one day, 1,827. This took place January 6th of this year. Now we are very, very different, much, much lower, 46 cases only in one day. So this is the count of number of cases in a single day. January 6, 2022, 1,827. February 28th, only 46. Now, this chart shows the number of deaths in our county. Total number of deaths since the beginning of the pandemic, 1,823. And as you can see, the highest number of deaths per day occurred in April 24th of 2020 with a total of 26. Right now, around 0 deaths for the last couple of days. If we look at how COVID is affecting our population regarding age and gender and race and ethnicity, the vast majority of COVID cases, that is people infected with COVID, took place with ages 20 to 39 years of age. More individuals in that age frame had a positive diagnosis for COVID. Regarding number of cases, there were more females than males. for the number of cases, diagnosis. When we look at same type of distribution, number of deaths, this is number of deaths. Most deaths attributed to COVID-19 occur in the ages over 70 to 79, then 80 to 89. And in this case, most deaths occurred around males, which is different from females in the number of cases. When we look at a number of deaths in our county for the last 14 days, we can see that we had a high number by February 11th of 5 deaths in one single day. But recently, we're only, thank God, only 0 deaths reported in the system due to COVID. Like I mentioned before, the average 14-day number of patients in 14 days hospitalized because of COVID is trending down. That's why you see these bars going down from left to right. The 14-day average of patients on ventilators, needing ventilators to assist them to breathe, the bars going down from left to right is decreasing, so that is good news. And the percent of ventilators in use is also going down, all good news. Regarding vaccinations, like many other jurisdictions in the country, after December 20th of 2021, everyone is experiencing a decreasing trend in the number of people vaccinated. Thank you very much, and I will be happy to answer any questions that you may have.
Victor, question. With the new guidance that CDC put out last week and the measures of severity that they're using, will you start to report on those numbers of admissions and percent of occupied beds?
Yes.
Those are the 2 parameters that are, guide the
Yes.
levels of recommendations in the.
The new CDC recommendation regarding COVID-19 level in the community, they have 3 measurements, low, medium, and high. And they base that on the number of hospitalizations, number of deaths, and so forth. Delaware County, as of February 25th, is in the medium, which changes what we need to do regarding mitigation. So we're 70% of the counties are in the middle and low, so we are right there.
Will you report those measures, the numbers of daily new admissions and percent of beds occupied by
Yes,
COVID
yes.
patients? Okay.
Yes.
Going forward.
Yep.
And if you don't mind, I'll add in, it will depend on how the state allows us access to that and what visibility we have on it. Last I heard, they're still working out the metrics on how that will be available to local public health.
Thank you very much.
Any other questions from the? Thanks, Victor.
Thanks, Victor.
Thank you.
At this time, the board has been asked to approve the new organizational chart and additional added positions of Deputy Director, Epidemiologist Research Associate, and Epidemiologist Investigator. May I have a motion? Seconded?
Second.
Any opposed? All in favor?
Aye.
Motion carries. And at this time, it's also my pleasure to ask Dr. Taylor to come up, and we are going to do a recognition of the Health Department Steering Committee. We're thanking them for the many, many hours of work over the last 2 years in support of forming the Health Department.
Thank you, Ms. Hall. So the steering committee has been working in the background almost over the last 2 years. It's really been, at one point we were meeting on a weekly basis starting in July of 2020, really through until now. They've been working with us to help us put together our original plan with our strategic trace, score, and flow, along with working through interviewing and going through all of the applicants, our 90-plus applicants for the Board of Health, and selecting the Board of Health, and then also helping with our themes and concepts around our program plans. And so they've really been a asset and such a huge contributor to what we've been trying to do in developing our health department. And we wanted to recognize them and say thank you to all of them for their service and their help in getting us to the point we're at right now. So I see that some of them have joined us today, and so what we will do is I will call out everyone's name once you're called. Please come up, grab your certificate, and we stay up front, and we'll the other ones. Peter Adamo, Shelley Buck, Rosetta Carter, Gary Davis, Alexandra Fields. Oh, do you want me to come up? Thank you. June Messam. Sarah McCullough. Letitia Okiki. Francis Sheehan. Sarah Smathers. Aaron Osman. Stephen Bradley. Catherine Cardillo. Anye Cleveland. Brittany Foreman. Michelle Garrity. Grant Gregwick. Grace Gorenflow. Meg Grant. Katie Lichtenstein. Vince Rangione. And Scott Schultz. I know. Well, thank you all, and to everyone who wasn't able to make it, we will mail out their certificates. But thank you all for your help. And
I did want to just point out, like, the coins that were given are a challenge coin, and it says Delco Strong, and on the back, it has the seal of the county. And so the challenge coins and certificates will be given to all the steering committee members that couldn't make it. Okay, at this time, we'll have our new business. Director Line, do you want to do the division reports?
Yeah, sure. So the topic of new business under division reports is I don't have division reports for you today as the Board of Health. However, I'd like for you to consider the idea that division reports would go to you ahead of time with the agenda so that you are able to actually read what's been happening in the department. And then when we come to the meeting here, if there are areas you want to dive deeper into, or if by chance there's a topic you want more information on, I can make sure that the right divisional administrator is available to be here to give a presentation or answer more questions, whatever that discussion would look like. And then how that would work is if you are approving of those division reports here, you can accept them into your meeting minutes so that it goes into official record. I think it's a really slick way, I don't know if that's the best word, a very slick way to sort of exchange information back and forth, as opposed to having report outs that can kind of go on sometime if we did all your reporting out each time. So I leave it to you all to make that decision.
And then, very exciting moment.
So the other part is the approval announcement, and this would have gone on the agenda earlier, but because we received this letter on Monday, we had to put it under new business. So the new business today is that we've actually received our letter of recognition from the State Health Department that indicates that we have gone through all of the process and we've been approved to be a public health department. So it basically indicates that thank you for your submission of the Delaware County Health Department plan and your presentation on December 9th regarding the proposal to exercise the powers and duties of a county department of health under the local health administrative law. And throughout the proposed establishment of this county health department, including after submission of your plan, your staff have regularly met with the Pennsylvania Department of Health, sought feedback, and made strides to create a successful health department. The amount of effort and work achieved in the commendable and demonstrates the importance that Delaware County Council has placed on providing comprehensive public health services in Delaware County. Following the presentation and additional follow-up meetings, a review of the plan and its revisions, and discussions with the staff, I have found that the proposed County Department of Health is ready to exercise its powers and duties. Please accept this letter as a certificate of approval, finding the Delaware County Health Department is ready to exercise its powers and duties. The Pennsylvania Department of Health looks forward to continuing to work with Delaware County and the Delaware County Health Department in promoting healthy behaviors, preventing injury and disease, and assuring the safe delivery of quality health care for all people in Pennsylvania. As required under Act 315, 30-day written notice of this finding is required to all cities, boroughs, incorporated townships, towns within the territorial limits of Delaware County. Only after this written notice has been given shall the Delaware County Health Department be established to begin exercising its powers and duties. This is sincerely signed, Acting Secretary of Health, Kiera Klein-Peter. So the letter was received on Monday, which means that then we had to put forward a letter notifying all the municipal officers, and that went out March 3rd. Notice is hereby given the Pennsylvania Local Health Administrative Law that on February 28th, the Pennsylvania Secretary of Health found that the Delaware County Health Department has met all criteria required to exercise its powers and duties and issued the enclosed certificate for such findings for Delaware County. So with that, we are now on our 30 days to get all of our pieces in place and demonstrate that we've been able to execute the powers and duties of running a local public health department, in particular around Act 315 and Act 12 responsibilities.
And what would be our start date?
Start date, April 2nd would be our actual approval as a public health department. You're welcome.
And I just want to take a moment to recognize the tremendous work that went into forming the health department. But to start that, you'd have to go back to 1968, when the first efforts to form a county health department began. And one of the people that was instrumental in that was Dr. Plotkin, had passed away last year, and one of his last words were to me, "Make sure you finish this." So I'm very, very grateful that I am here tonight with so many of you in the audience who've been so supportive, our board, the steering committee, I really want to particularly recognize Dr. Taylor and members of council that really stood behind it, and Executive Director Howard Lazarus, who really helped make this possible. It takes true leadership to carry on something this complex and difficult to the end, and it wouldn't have happened without everybody working together, and not only working together, but in the middle of a pandemic. And you know, I can't tell you the countless hours and emails and phone calls that happened at 12 midnight and 5 a.m. and and lots of things in between. So it's really heartening to be here tonight to be able to finally say the words that we are an official county health department. So with that, we'll close our new business unless any of the board had any comments. And at this time, we'll allow public comment. For our public comment, you have 3 minutes, and we ask that you say your first name, last name, and address, and you can come to the microphone. And I ask the county solicitor, our timekeeper.
I'll keep the 3 minutes. I'll warn people when there's 30 seconds left. And just a reminder, this is public comment. It is not questions and answers. If you do have questions and the health director or the board has an answer and choose to answer, they can, but there's no requirement that they answer. This is for public comment.
Actually, 5 minutes. I'm going to ask if possibly permit me for 5 minutes.
5 minutes is what the council sets. The Board of Health has its own time, which is 3 minutes. I'll defer to the chair as to whether she's willing to permit that.
Sure.
I'll try to be as I can. My name is Diane Coughlin. You need my address, name.
Yes,
That-
please.
35 King Road, Pennsylvania. I'm a nurse practitioner. I've been working in healthcare for over 30 years. I'm also vaccinated after taking one Moderna COVID-19 vaccine in January of 2021. Its effects have been long-lasting. Once this occurred, I immersed myself into the data around COVID-19. I've reviewed enormous amounts of evidence-based medicine, scientific data. As members of the Delaware County Health Board, I implore you, please do the same. The rhetoric on your website, in particular, facts over fiction, where, and I quote, "Fiction is someone who peddles more rumors than Wawa peddles coffee," leads me to believe that you've not studied all the data, and your site does not spell out the complete truth. Nurse Steele's caption is not factual, and it reads, "There is no evidence that any vaccines cause fertility issues." Let me inform you that the number of miscarriages in our country is up 2,000% since COVID-19 vaccine rollout. Numerous women are also reporting issues with their menstrual cycles, and the evidence supports that these vaccines pose a significant risk to women. I want to talk about more facts, and I've cited everything that I will present to you, and you can review it. Did you know that in November 2020, Dr. Peter McCullough and other physicians provided Senate testimony that ivermectin and hydroxychloroquine were safe and effective to treat COVID-19? These physicians were ignored, censored, demonized, marginalized by our government and what I consider our mainstream media. Yet these meds have been used successfully by thousands of clinicians to treat COVID-19, myself included. Read the studies, please. Countless lives could have been saved early in this pandemic. Nowhere on your website could I find these medications mentioned, nor did I see vitamin C, zinc, quercetin, or vitamin D recommended, which can also help with this virus because they boost the immune system. COVID-19 vaccines are not safe and effective for all. VAERS data has captured hundreds of thousands of vaccine injuries and deaths. There's no such thing as informed consent. We do not know the long-term effects of this vaccine, nor does the CDC, the FDA, any government official, or any of you on this panel. I have an 80-page document, and I would like to leave it here with you. This is numerous vaccine injuries. These are peer-reviewed articles, and I feel that if you were to read this, you would truly understand how many people have been vaccine injured. I would also recommend that you view the COVID-19 A Second Opinion video, whereby Senator Ron Johnson convened a panel of experts and vaccine injured to talk about vaccine efficacy and safety. It's quite enlightening. Children with no comorbidities have a 0% chance of dying from COVID, and they do not need this vaccine. Their immune systems are robust. Pfizer just released information that the
1 minute.
vaccine for 5 to 11-year-old children, it has a 12% efficacy rate. Natural immunity has been completely overlooked, yet essential to consider. An article in JAMA reported antibodies up to 20 months in unvaccinated adults after testing positive for COVID. So let's put numbers in perspective. The CDC estimated by September 2021 that 44%, or 146 million Americans, had contracted COVID-19. In January 2022, a video on your website, Dr. Lisa O'Mahony reported that cases in Delaware County had risen to over 28% over the holidays. Adding those percentages together would suggest that over 72% of Delaware County residents have already contracted COVID. Therefore, they have natural protective immunity, and they
The
don't
speaker's
need
time
a
is over.
vaccine. So let's review the facts. There's enough data available that clearly shows vaccine effectiveness
The speaker's time
has
is over.
dwindled. I understand that.
You were
As
given
these-
extra time, and your time is over. It's up to the chair to allow you to
Okay,
continue to
I
speak.
only have a couple more sentences, honestly.
In fairness to the others that have to present or want to present, given the time.
Would anyone like to give me their time? Thank you.
I-
There's enough, I'm just going to.
Just two more sentences, please, because we already gave you extra time.
There's enough data available to clearly show that vaccine effectiveness has dwindled as those who are vaccinated are getting COVID too. Natural immunity far surpasses the vaccine. Safety should be an absolute priority here, and these vaccines are causing injury. There's zero data to support that healthy children need these vaccines. You're putting them in harm's way by advocating for them. I just start promoting safe and effective treatment. Healthy
Excuse me, this is
lifestyle.
far more than 2 sentences. Could you please wrap up your remarks? Thank you.
Yeah,
So you can leave your presentation with the director, please.
that's fine.
Thank you. At this time, is there any other public comment?
And again, we're going on 3 minutes. I will warn people when there's 30 seconds left. Thank you.
Okay, thanks. Good evening. My name is Bill McIntyre. I live at 215 Cherry Hill Lane, Broomall, Pennsylvania. You know, it's glad to hear we have a Department of Health, and I really am looking forward to seeing how the department's going to allow the county to remain healthy. When you look at, you know, this isn't the Department of Viruses, the Department of Illnesses, it's the Department of Health. And what factors are involved in keeping people healthy, and healthy people, even if they get the viruses, are more likely to survive. So, you know, things that I would be hoping to see is that, you know, continued effort to keep our food sources safe, our environment, you know, clean, fresh air, the soil and the ground around us free of chemicals and deadly pollutants, sanitation and nutrition are key factors in keeping people healthy. And I'd like to see an emphasis on the Department of Health on keeping people healthy. So the next time something like COVID or whatever rolls around, we'll have a healthy population. Population that will be able to fight this off. And when we fight off viruses, we build a blueprint in our DNA to fight off the next one. Mutations, our body already knows how to deal with most of it because it dealt before. Just has to work on the little changes. So again, I'm glad we have a health department. I want you to keep us healthy. And I'm looking forward to the day when we're here and we're not talking about the viruses and this, that, and the other, because we got a handle on this stuff. The other thing that's always important to me too is the personal relationship I have with my physician in making choices. So when it comes to my personal health and illnesses, I like to have that opportunity to get the information and the feedback from my doctor, because my doctor knows me and knows what I would get an adverse reaction to do. If the vaccination had weak, guess what? I have a problem. You don't know that, but my doctor knows that.
30 seconds.
So again, congratulations. I'm looking forward to seeing Delco become one of the healthiest counties in the state.
Thank you. Is there any other public comment?
If people have public comment, you can start coming up as the other speaker is sitting down. Thank you.
My name is Linda Cosgrove. I'm at 643 Creek Road, Brookhaven, PA 19015. I am a COVID-19 survivor, 2021. I just wanted to read a letter that I sent to Senator Kane after his newsletter was delivered to our houses 2 weeks ago. Dear sir, thank you for your recent newsletter. However, I am very concerned that you did not mention the plight of so many Pennsylvania healthcare workers who have been terminated for refusing the COVID-19 injection under religious objections. I would love to speak with you about this tragedy. I look at vaccine mandates as medical rape. Both want to inject a fluid into a person without their consent. Just like sex and vaccines are wonderful, but under force or coercion, it is wrong. Many employees notified their employers of their need for a religious accommodation, and many, like myself, had their religious beliefs trampled on. Denying a religious accommodation based upon the views of others who do not share their sincerely held religious belief is unlawful. Employers are only supposed to accommodate or demonstrate an undue hardship, period. Do you understand that many people feel the same as I do? In Pennsylvania, the cradle of liberty, where William Penn established this Commonwealth as a haven for religious freedom, citizens are being denied their inalienable rights to religious expression. This is no different than when a Muslim woman who requests a religious accommodation to wear a hijab and a Christian who requests a conscientious objection to a vaccine. Religion is subjective and therefore must be individually protected. Civil liberties that you are supposed to be upholding are becoming challenged under your watch. We all must work together. COVID-19 protocols should never allow people to lose their liberties. This is un-American. What kind of country do you want for your grandchildren or great-grandchildren? Freedom is not free and is the most important right in a free society. PA has been losing residents for nearly 30 years. Middle-class New Yorkers have fled their state due to their harsh government overreach. People will not tolerate this government overreach much longer. Just like our forefathers crossed the Atlantic Ocean for freedom and opportunity, so will the people who feel oppressed at this time. You are always in my prayer. Respectfully, me. I do thank you for coordinating the Delaware County Health Department, and I just pray that it goes in the right course. Thank you.
Thank you. All right, at this time, seeing no other public comment. Okay, we're just going to ask that if you have public comment, if you could come on up.
You don't need to wait to be invited. As the other speaker finishes, you can come up.
Okay, so I just want to say that as the COVID vaccine...
Excuse me, could we have your name and address, please?
I'm sorry, Terry Bell, 43 Preston Over the past 2 years, when the COVID vaccines rolled out, I watched in horror at the way people were treated. I saw public officials trying to bribe people with cheap junk food to get the vaccine. And I watched as the news media joined with politicians to coerce people. If you're not vaccinated, you're called hesitant. If you're not vaccinated, you're uneducated, you're misinformed. They called people selfish. They told them they were unpatriotic. These tactics are unethical, and they're abusive, especially when they're used by people who have the power, the political power. And I can't understand why they're tolerated, because the public deserves so much better. They deserve respect, and I hope that's what we see with you. I am so happy you're here, and I know you've worked very hard, and I know you're going to continue to work hard. Please, the public deserves respect, not ridicule.
Thank you. Okay, seeing no other public comment, I want to thank everybody for their comments tonight, and then I also want to offer an opportunity for any of the board members at this time to make additional comments. Okay, well, thanks everyone for your comments tonight, and our next board meeting is May 22nd, or May 2022, sorry. And our board information is on our website if you need additional information about the Board of Health. And at this time, I would call for a motion for adjournment. Second. All in favor?
Aye.
Aye. Okay, we're officially adjourned.